How you doing? I'm Dr. Chris Cueto from Herald Chiropractic and Sport. I'm actually here with a patient who actually came in with a shoulder issue in terms of which is affecting his throwing mechanics. After examination, I actually noticed that he has a little bit of a posterior capsule issue, maybe developing with some adhesive capsulitis or frozen shoulder. So he's been here with me now for a couple of treatments already. We've actually been seeing some good improvement. But the problem is with him is still the whole throwing mechanism of the ball. So what I'm actually going to do besides adjusting is using the FAKTR method. So as I do the FAKTR method, we just start him off in a static position, no movement, working on the general areas around the shoulder. But then a big part of this now too is also including the actual motion itself, where he's getting the pain. So as I'm doing this, he can start throwing or go into the throwing mechanism, throwing motion. And as he's doing that, I actually work with the shoulder itself, little by little. A couple of things I also want to examine, as seen as the whole body, is the rest of the spinal mechanics. So again, adjusting is important, clearing out the rest of the spine. At the same time, also looking at the core itself. As a baseball player, as anybody throwing itself, one of the things we want to make sure is you also have a strong glute work here. Glute medius, gluteus maximus work. Notice that when he's also throwing, he's also very weak in his glutes. It's also affecting him to overcompensate and thus your throwing itself. Very important for pitchers to understand that. So after, as I work with the shoulders itself, we might actually get it right into the actual pelvis, start adjusting it possibly if he needs it, and even start going into any type of major work and strengthening the glutes itself. I'm Dr. Chris Cueto from Herald Chiropractic and Sport. You can reach us again at www.heraldsquarechiropractic.com.